Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General.
And I'm Stephanie. I'm an intern here at the Blum Center.
Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it will be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has been muted so we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask a doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I'm going to turn it over to Stephanie, who will introduce you all today's guest speakers.
Welcome, everyone. Dr. David Lin is a neurointensivist and the director of the MGH Neuro Recovery Clinic with the Department of Neurology. Jack Smiley is a stroke survivor, also within the Department of Neurology. In recognition of Heart Month, they join us today to give a talk on recovery after stroke, patient, clinician, and scientific perspectives. Please join us in welcoming Dr. Lin and Mr. Smiley.
Thank you very much, Amy. Thank you, Stephanie, for the introduction. Wanted to thank the Bloom Center for all their support and thank everybody who's online today for joining us. We'd like to encourage lots of questions in the chat. We're going to start with a few slides about stroke recovery, and then I will turn it over to Jack, who will talk about his recovery journey, and it'll be a back and forth there, but we'd love to leave time in this hour for questions from the group. So I'm going to share my slides. Okay. All right, so I'm a neurointensivist at Mass General Hospital, meaning that I care for patients in the intensive care unit in the Lunder building. I also direct the outpatient clinic at MGH, where we care for patients who are recovering after critical illness, whether that be stroke or traumatic brain injury or anything that lands patients in the ICU. So I'm going to start by sort of framing the problem. This is a view from the MGH helipad. This is a helicopter landing out in the distance and landing on our helipad. This is me now, many years ago, as a ICU fellow, bringing a patient who had received TPA, which is a clot-busting medication for acute stroke, in New Hampshire, and was brought to MGH for retrieval of their clot. So this is the middle cerebral artery on the right, and you'll see here that there's a clot that is impairing blood flow going to the arteries here. And this is post-intervention after a neuroendovascular surgeon or a neurologist or radiologist has gone in to retrieve the clot. And you see that the blood flow is restored in the middle cerebral artery. The past 30 years has really been a transformative time in acute stroke, from TPA in the mid-1990s to endovascular therapy that really came about in the sort of 2015 era. Really now acute stroke is a treatable disease. But the truth is that only 1 in 20 patients are eligible for acute stroke treatments. And as a result of that, stroke remains a leading cause of adult disability. There are over 800,000 people per year who have stroke. It's very common in the United States. It causes impairments in motor, in language, and in cognitive function. Uh, our talk today, the science of what we're going to talk about is going to focus a lot on the arm and hand, which is a it is a major source of this disability after stroke. And in stark contrast to acute stroke trials that have had a lot of success in the last many years, our trials to improve recovery after stroke have really been variable and really have had limited success. And also in contrast to the new therapies for acute stroke, our therapies to improve how patients recover after stroke remain quite limited. So, superimposed on the biology of acute stroke is the stroke recovery journey. So, our patients transition from acute hospitals to inpatient rehabs. In Boston, that would be Spalding, to home to outpatient clinic. And in that time, our patients go through an entire journey across this care continuum. Some patients recover very well and are back to their everyday life. Other patients recover moderately, and other patients have more limited recovery, where they might never return home and be in a nursing home. A big interest in neurology is trying to understand these recovery trajectories. Um, and I would say traditionally, what's been challenging about stroke is that there hasn't been a quarterback for patients across these phases of care. Usually in the acute hospital, it'll be people like me who are trained in neurology who will take care of stroke patients. In rehab, there's a different care team. And then when patients transition home, there's even still different providers that care for patients. And I would say that one of the difficulties in both providing care and doing research to improve recovery after stroke has been that there hasn't been one clinical care team across the care continuum of stroke. There's a whole biology that we think of that underlies stroke and stroke recovery. So in acute stroke, uh, really this biology spans minutes to hours. So there's cell death and inflammation and scarring that's caused by the acute clot. There's circuit level changes that happen. For example, one part of the brain is essentially not connected to another part in the acute setting because of where the clot impairs. And at the behavioral level, there's also rapid change. That is distinct from stroke recovery biology that takes place over weeks to months to years, where there's at the cellular level, there's changes in blood vessels and neurons and synapses. At the circuit level, there's shifting cortical representation. And the recovery that happens for patients really happens over weeks to months to years. And so some of us in the field look at this as an area of opportunity, right? Because acute stroke treatments really have a biology to capitalize on within minutes to hours. But if we could make something work in the more subacute to chronic stages, you have weeks to months to years in order to look at this biology and really engage it. So through our conversation today, what we're going to try to convince you of is that really to develop new therapies for stroke recovery, which have lagged behind acute stroke, we need to, one, keep the patient at the center of our mission. Jack and I will talk a lot about his recovery journey today. And we need to better understand the basic biology of stroke recovery. And lastly, we need to understand the mechanisms of stroke recovery in humans and translate the basic biology that we understand in the lab to how humans recover after stroke. So with that, I will turn it over to Jack. Jack, do you want me to play the video first, or do you want maybe you could introduce yourself and then we can either turn it to your slides or I can play the video after.
Yeah, I'll introduce myself, play my slides, and then we'll go from there.
Perfect.
Hello, everyone, and I just want to say thank you to everyone for having me, inviting me, and thank you to Dr. Blum for the science and introduction there. A little introduction of myself. I was actually one of Dr. Lynn's patients back in the day. About 3 years ago, I had a stroke of my own, and that's what I'm here to talk a little bit about and share my story. And to get into a little bit more of who I am before we get into my story, I'm currently a undergrad, or going after my undergraduate degree in exercise science at Endicott College on the North Shore, about 30 minutes north of Boston. And it's at this college that I play men's ice hockey, NCAA men's ice hockey at the collegiate level. And that's important to note because it's the reason that I had the stroke. In my sophomore year, everything in my life was normal. I was a very athletic individual growing up. I loved playing multiple different sports, being active in various different activities throughout my day. And it led me down the path of falling in love with ice hockey. I developed a passion for it, and it carried me into college here, close to Boston. And I entered college as a NCAA Division III ice hockey athlete. And in my sophomore year, during an ice hockey practice while we were on the ice, I collided with a teammate. And that collision, it wasn't crazy or severe or anything I hadn't felt before, but unbeknownst to me, it caused a small fracture and a vertebrae in my neck. And it wasn't initially noticeable, and I didn't feel anything other than neck tightness at the very beginning. But about a week after the ice hockey collision, I ended up having a TIA. And during that whole experience, I lost the motor function on my left side for about an hour. And by the time I got to the hospital, it was completely resolved. I was back to normal, feeling fine. I didn't think anything of it. And about a week after that, so 2 weeks after the ice hockey collision, I ended up having the main stroke that left me with the deficits I face now. And we will get into a little bit about that, but before we do, I want to share my screen and share a little slideshow that I put together to sort of visually depict the journey while I speak about it. So I will share my screen here. Everyone can see that. All right, so getting into the actual timeline, and if there are any stroke survivors in the conference right now in this presentation, you know that it's damn near impossible to encapsulate the journey into however much time we're going to have on this call, but I'm going to do my best to condense it into a couple minutes here. So my journey really differs from the average college student during that sophomore year. And this is a video montage of me before the stroke. So as you can see, just a quick little montage of my physical capabilities, what I had the most interest in, and really just being a normal young man attacking life in all regards and really taking pride in all my physical capabilities. I think that's one thing that I really loved about being an athlete and being active and moving around so much is that level of physicality and activity throughout my day. And that really changed completely in a full 180 in my life trajectory during that sophomore year when I ended up having a stroke. And this next video sort of encapsulates really what happened that day, and this is going to be the very next day after the stroke took place.
Have to promise me positive thoughts, not knucklehead.
Majority positive
Okay,
thoughts.
that's fine. Majority. You're allowed a few lousy days because you're gonna have to have a few of those.
Yeah. Majority positive thoughts.
All right. All right.
Now, I hope everyone could hear that. Zoom isn't always the best at portraying videos through the screen, but if everyone could hear that and see that, I obviously was a very different person than that first montage, and even than I am now. The speech in my voice and the articulation of words and how my brain was really connecting with the rest of my body in so many different ways was drastically changed due to that stroke that I suffered on February 21st of 2022. And getting into a little bit of what exactly happened within my stroke, because I've learned from being on this 3-year journey is that every stroke is so different. The brain is so complex, and there's so many individual factors that really go into each individual journey. My stroke ended up happening in the pons, so in the brain stem. And as I mentioned before, it was due to a fracture of that vertebrae in my neck that led to a dissection in the artery and ended up resulting in that stroke. As I briefly touched on, the TIA happened a week after, but I initially had absolutely no idea what was happening. I had complex migraines as a medical history in my youth, growing up in my childhood. So I originally just thought it was a side symptom of having a migraine or some kind of headache. So I didn't think anything of it until that major stroke happened 2 weeks later and left me with that complete loss of motor function. My speech was severely impacted. I couldn't eat, I couldn't drink normal liquids. I was on an initially I was on a thickened liquid diet. I couldn't eat regular food, but I also couldn't drink normal liquids because they were too thin. So it was a very, as I mentioned before, it was a complete alteration of where I was in life and really the trajectory that I thought my life was on. And this is a little video of the first day out of the ICU. I spent about a week in the ICU, and that's where I met Dr. Lin and was under his care, overseeing my initial just it was 5 days of that initial making sure that I was stable and nothing else was going to happen. I wasn't going to have any other strokes or side effects of the stroke, and making sure I was physically able to be transferred into physical therapy. So this is a little video of that first day in the inpatient care at Spalding is where I transferred to.
That's gonna fall out.
Can I do it?
Just able to open a water bottle. I can't open this. You do?
Yeah.
Stop moving.
And I know there's not a lot going on visually in that video, but there it's really depicting me in that wheelchair with the complete, as you can see it, if you notice, it's small, but you can see I'm not moving any part of my right side. My right leg is totally immobilized and held up by the wheelchair. I couldn't open the Gatorade bottle because there was no motor function between my brain and right arm. There was nothing there, and my speech is still affected at this point greatly. So I'm sure many people can relate to the frustration of not being able to accomplish those small tasks anymore. And going on into the inpatient experience, this is a little clip of some of my inpatient activity. Just a short clip, and that's not even remotely close to showing all of what took place. But describing the inpatient journey for me, I spent that initial 5 days in the ICU as I described, and then continuing on when I got placed into the inpatient care of Spalding, I was there for about a month. and they gave me some very intense therapy. It was sometimes 5 to even 7 hours of therapy a day based on if the therapist had extra time or someone else on my floor canceled or didn't want to participate in therapy that day. So it was a very grueling, they really created a system pushing me, and it was at least an hour of physical therapy, an hour of occupational therapy, an hour of speech therapy. And then if they had time in the day or my schedule allowed it, they would put me in recreational therapy, which could be so many different things, and going from little bike rides around the Boston area to they even took me to an ice skating rink. I'll get into that in a little bit as well, but just the care around my journey is what initially set me off on the trajectory to have such a drastic recovery. And I think that's something that, as Dr. Lynn mentioned, and something that we really try to get the message across about in this presentation is how important it is to keep the patient at the center of the recovery journey. And even from my initial days in that inpatient therapy, that's what was done for me. I was doing things like you see in this video, bench pressing to try to activate those chest muscles, going from that into just moving my right hand along a sliding board in occupational therapy. But it was such a rigorous, and they really made so much time for me to do so that it allowed me to just get those repetitions in, get the reps in as much as possible. And I kept asking them for more because I knew that's what I needed at that stage. And this is the video of I was still actually in patient therapy at this point. Had a room at the hospital and everything. I was in the care at Spalding, but I actually made a promise to Dr. Lynn he's on the call right now. I made a promise to him in the ICU that he would see me on the ice again in 3 weeks after my stroke took place. And initially, I didn't really realize how drastic of a recovery this would be and how severe a stroke really was. So in that initial statement to Dr. Lynn, I thought I was going to be completely fine again, back to my normal routine in 3 weeks, back at college, back doing the activities of a NCAA athlete, working out, skating at the same capacity I was before. Obviously, there is more to a stroke than I initially thought. At least there was in my individual case. So I wasn't back to that point yet, but my care team at Spalding, my therapist knew that I had mentioned this to Dr. Lynn. They knew I really wanted to get on the ice at least, even in whatever capacity I could. I was bugging them constantly. I was like, let's get on the ice, let's find ice. And me, I said it jokingly because I was barely allowed to go outside. It was really that I was in the hospital. I had the room there. I was stuck in my wheelchair. I couldn't go anywhere on my own. So I didn't really think it was possible, but coming up to that 3 week mark, a couple of days before, Will Santana, one of my therapists, he's holding me up in this video, came into my room and was just like, "Hey, what do you think about getting on the ice?" And I was like, I've been mentioning that to you guys for the past 2 weeks now. Let's do it." And they fought for me. They made it happen, even though it was something that was so far out of the realm. They had to find a rank, they had to find transportation, they had to get clearance from Spalding to actually transport me. There were so many variables that went into it. But going back to keeping that patient at the center, they knew that that is what I needed. They knew that it would provide so much motivation for me to get out there and to even just attempt doing it. So this is a little video of me walking onto the sheet with my cane and stumbling around, but they helped me achieve that, even if it wasn't in the capacity that I was used to or that I thought I would be at. Obviously, that's not exactly the athletic ability level you think of when you think of a NCAA ice hockey athlete, but I was pretty proud of getting on the ice at that stage and even attempting to walk. And I can't give enough credit to the therapist in this video and really everyone that made that happen for me, because I really had no business being on that ice, but it was a very, very key moment in my recovery. And I was able to actually take that video to Dr. Lin that day because I had to follow up with him in the afternoon and show him and just say, hey, you didn't think I could do it. I did it. And then going into the outpatient recovery, I have another little clip here showcasing the progress in my hand and some activities we did while I was in the outpatient journey.
Oh, that was my best one. All I needed was the damn camera.
You were born for the spotlight.
That's exactly it.
So this is about a month and a week. I got discharged from Spalding inpatient therapy exactly a month after I had gotten there. So this, when I transferred into the outpatient therapy, it was exactly a month after entering inpatient therapy. And I spent the better part of a year doing outpatient therapy. The schedule was taken down from about 5 to 7 hours of therapy a day to going into outpatient therapy. It was around 3 hours a day. They had me in physical therapy still. They had me in an hour of occupational therapy, and they had me in an hour of speech therapy. And those were really my main sanctioned physical, occupational, and speech therapies per day. And it started weaning down into around 3 days a week. And I did that for the better part of a year. But since my schedule really was reduced and there wasn't as much set therapy per day for me, I had a feeling in my body, and through talking with a lot of professionals in the field, doctors, neurologists, I know even other therapists, they really guided me in the direction of creating my own therapy plan. And I started doing just all sorts of miscellaneous things. And it really was a lot of help from my mom as well. She helped organize some of those activities and brainstorm some of those activities in the initial days of outpatient therapy. But I really cultivated, out of the support of everyone, my own therapy guide and plan. Coming out of that, I started doing, as I mentioned, that equine therapy a couple days a week. I did dance lessons through the advice of a neurologist that I was seeing through Dr. Lin's neuro recovery clinic. I started doing MMA, which was I took it a little too far at one point, but I was doing a lot of MMA, striking a bag for physical coordination and just getting that motor function back. But there were so many different things, and I do have a little video showing more of that later in the slideshow. But at that stage, when I was really getting released from the extreme 5 to 7 hour inpatient therapy sessions a day, I knew I needed more than the 3 hours that they were going to give me. And I really tried to do everything under the sun that would allow me those repetitions and to keep my body moving. And really engage my mind and reconnect to my body. I'm gonna pause it real quick because it just seems like a video of me flexing. And through the PowerPoint, I will say that I don't know what happened, but it's not showing the thumbnails for me before. So this video is actually, you're gonna see in a second, but a couple months after the stroke, it was crazy to me how fast my muscle really left. And through the inactivity of not being able to use my right side, I the muscle atrophy was crazy. And you can see in a second the left side, this is my unaffected side that's showing right now. And then on the other side, when I turn, is the affected side about 3 or 4 months after the stroke. I still had not as the normal movement was nowhere close to where it had been. My strength is still very limited, and you can see that the muscle tone and just the size of my muscles had greatly decreased.
See those tries?
And in that last image, you can see it clear as day how incredible that really lack of muscle and lack of movement had affected my body. And I just think that's a really crazy aspect to look at and something that I've worked hard at getting back ever since. And this is the last little montage I have about my recovery, and it's the main thing that I look back on and want to convey about my own journey in hopes that it can inspire others or showcase really what has set my recovery apart from the normal or what's typically seen. I've heard from medical professionals that did not expect me to make the recovery I've had, and I wish that I could showcase it in person. It's hard to see through a computer screen, but I am 3 years out from my stroke, and I am much farther along than I think anyone would have expected, that I would have even expected after I really gained a full understanding for what stroke was. And I'm nowhere near the point where I would like to be, but there's this typical thought process of after a certain amount of time, after that 9 month frame, after a year, you really don't make progress anymore. And I can say from my own recovery, I'm about 3 years post stroke, and I still feel the progress to this day. I still feel like I'm making a lot of progress and a lot more recovery than I would have ever thought possible at this stage, given what I initially heard. So I want to show this little video showing a little bit of what I've done, and it carries through that entire process. Like this first initial clip is going to be some equine therapy from the very beginning, and then the last clip is of me skating now. So I hope it conveys really where I'm at.
You hold on to it.
Now, I do promise that that's actually the last slide I had, but I do promise that I had a way harder shot and skated a little bit faster a little over 3 years ago than in that last clip, but I really have made way more progress than I've ever thought possible, and in that skating clip, it's getting better and better. 2 years ago, when I initially was told the progress would start weaning out and I would not be making much progress anymore, I was nowhere near what that clip shows and where I'm at now. So the biggest message I can say for any clinicians that may be on this call, any therapists, any doctors, is that recovery is very possible, and making the journey about the patient and about what they need, given how individualized stroke really is so important and so key in motivating the patient and finding what they need for their recovery. And for any patients that might be listening, any stroke survivors on the call, I think it's very important to know that you can make progress. You just got to find the ways that best suit you and what you need, and doing all of the things that really get those repetitions in, and believing that it's possible when no one else does or when no one else really knows is is very key to recovery.
Thanks so much, Jack. It's always so inspiring to hear your story. So we can open it up to patients, or sorry, to the audience, and we can also keep talking as well. So I see a question in the chat. Amy, do you want me to just read it out loud and we can
Sure,
start?
go for it.
So there's a question from Karen. Well done on your recovery, Jack. How was your body able to handle that level of stimulation? Did you suffer from neurofatigue? That's the first part of the question. I'll read the next part later.
Yes. Yeah. So the handling the level of stimulation was definitely, and still is, even 3 years out, still a battle that I face, and something that I try to work out as best that I can. In the initial days when the therapy was so intense, I was sleeping a ton. I would get done therapy at 5 or 6. I would have dinner, and because it was actually COVID, the COVID rules and regulations were still in place during my recovery and while I was inpatient therapy. So they would kick out all visitors at 8 p.m. My parents would be there every day supporting me, but they would have to leave at 8, which provided me nothing really to do after 8 p.m. And by that time, in those initial stages, my body and mind were completely done, completely fatigued anyway. So I would end up just uncontrollably passing out at 8:30 and going to bed at 8:30, which I had never done in my life before. I was never an 8:30 bedtime kind of guy. But that neuro fatigue, it just shut my body and brain down at those times. And I would end up getting way more sleep than I ever had before, but it would allow me to then go do the activities of the next day. And I would be getting fatigued. I would be having those neuro post-stroke fatigue, mental fatigue symptoms, but it was that level of sleep that allowed me to do it. And I still, to this day, 3 years later, I feel it. It's not as great as it was in the initial days. I'm able to stay up past 8:30, but I try my absolute best to be in bed and get at least 8, sometimes more if I can, hours of sleep a day. I'll take naps if I can and if I need it to combat the symptoms of nerve fatigue, but there are definitely times where I'm weighing the balance of what should I do here? Should I push through it and get the repetitions in and keep doing this activity even though I feel that level of fatigue? Or is it better for me to just go to bed, take a nap, rest, do whatever I can to not put myself through that and the extra level of exertion that comes with whatever activity I was doing. So that's still a debate in my mind, and every situation is different. It really depends on how I'm feeling in that moment, what the level of fatigue is, and what the activity is. And I think that's something, and I sometimes don't know if I've made the right call, but it's always a debate in my mind of should I get rest here? Is that what I think my body needs more? Or should I power through it and do the repetitions?
Along with that, I think you partly answered this, but Karen asks if you think that your young age and physical activity level as an athlete helped you with your fatigue.
Yes, I definitely do. And with conversations I've had with professionals in the field, the work I've done in Dr. Lynn's neuro recovery lab and the things that he's allowed me to be part of and the conversations that has given me the opportunity to be part of. It seems to me right now, this is definitely a good question for Dr. Lynn to chime in as well on the scientific side. But for me, I feel like my young age and the level of activity that I had taken place in during my life before the stroke and being at the NCAA level as an athlete and really knowing how my body worked and participating in a sport that really used everything. It was agile sport, fast sport. You needed your balance on the blades. And I think all of that combined allowed me to have a level of knowledge about my own body and feeling of my own body that helped with my recovery, but also the lifestyle that I led to make that possible, the nutrition that I put in my body, having working towards just a certain physical and activity level. I think all of based on the brain and how complex it is, I think everything goes into it. I did a lot of mental imagery in the initial stages after my stroke too, just sitting there in my hospital bed thinking about how my muscles moved. And I don't know all these scientific research studies about every certain aspect of what goes in where and how much each thing affects recovery. But for me and the way I tackled my recovery, I just thought that everything affected it. The way I lived before the stroke, the way I lived after, especially sleep, nutrition, activity level. I think all of it.
Yeah, I'll just add that in terms of post-stroke fatigue, it is definitely a known scientific entity. There are many labs and folks around the world that are trying to understand its mechanistic basis a little bit better. It's thought to be due to the inflammation in the brain caused by the stroke. Um, um, and there are some studies that have trialed actually uh, have 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 trialed medications to some effect. There was a clinical trial, which is called the Midas trial, that was done, I think, about 10 years ago, looking at the effect of a neurostimulant on post-stroke fatigue with a positive effect. And so some patients um, who have come to see me who really have really debilitating fatigue will put on medications. But so I would say if you have post-stroke fatigue, it's common, it's known, and I would consult with your neurologist about treatment options. You just have a shout out in the chat, Jack. It says, Jack Smiley, you are such an inspiration.
Thank you.
Here's another question from Christopher Luke that says, 2 years ago, my world changed. I couldn't move the right side of my body. Sounds like this person in the audience also had a stroke. Um, but fast forward today, he is training for a full Ironman. Just a month ago, he even managed a half marathon. Let's see, trying to find. My right arm is still affected. It looks completely normal, don't get me wrong, but functionally it's different. I swim well. When running, I can swing it up, but under heavy effort. I'm not sure how to train or treat this properly. And insights would be greatly appreciated. Christopher. Thanks so much, Christopher. We'd be happy to see you in the neuro recovery clinic. So if you want to just send me an email offline, be happy to see you, and we could examine your arm and provide you with any recommendations in the clinic.
Dr. Lin, should they send an email to, is there like a main clinic number or directly to you? If so, can you provide that in the chat?
Sure, yes. Actually, I can provide our neuro recovery clinic email in the chat. I will do that. We'll take in. I have a question for Jack, actually. So, Jack, through all this, you've talked about so many different elements to your recovery. As you went through it now, looking back, what are some of the most important elements? You talked a lot about many different things like perseverance and pushing through things and believing that recovery continues to happen in the chronic stages. If you could sort of distill that down, like what are the most important aspects of recovery that you think now after this journey that you're still on?
I think there are so many crucial aspects of recovery, but if I could boil it down, I think the number one thing is to believe, the patient has to believe they can recover and have the motivation to make that happen. And that includes setting the steps forward of reaching out, finding avenues to make it happen, like talking with the neuro recovery clinic and figuring out the next steps through professionals, or just having an awareness to their own body and figuring out ways to put that together and make steps forward. So I think the initial thing is you got to believe that it's possible, because that's the foundation that's going to allow you to move forward and find ways to make it possible. And then I think number two is making way for a support system and realizing that not everything is going to happen on your own, and you can find people that either have been through it before and are happy to share insights, professionals, neurologists, therapists that can help guide and really just getting distractions out of your life and getting the negative people that don't support you, getting negative things that take away from your own health mentally and physically out of your life, to really provide the space to make the most out of your recovery. And then obviously repetitions over and over again, making sure that you're working towards what you want.
Yeah, I'll just add on to that to say that, traditionally, neurologists in general are mostly involved in the acute side of stroke and stroke prevention. And they're traditionally, that's changing now with our program and some other programs across the country. But traditionally, neurologists have not been as involved in neuro recovery or stroke recovery. I think this is a really exciting time for the field, and it's a growing field. And so we're really encouraging younger neurologists to be exposed to neuro recovery. And there are new treatments coming. So I'm quite excited about the future of neuro recovery.
We also have a question in the chat whether Dr. Lin, your team, your clinic, if you work with Teddy's team in any way.
Teddy's team. Yes, we do. so Teddy's team, I think the formal center is at Mass General, is at the MGH Institute of Health Professions, or the MGH IHP. But we have close affiliations with them. There are a number of labs there that work with our lab. And yeah, they're a great center and resource.
Thank you. And then we have a question. This could either be for both of you, Jack, Dr. Lynn. Do you have any tips for stroke caregivers?
That's a great question for both of us. I can start. I would say that stroke is definitely a family disease. It affects everyone. It affects not only the stroke survivor, but those around him or her. And in the journeys I've seen, those undoubtedly that have been most successful are those patients that have people around them that provide support. So I think caregivers are really important. That being said, the disease can also take a big toll on caregivers, and so it's really important to take care of yourself as well. Um, and yeah, I will say that we have developed caregiver resources in our program here in lab. So if you have any questions about that, feel free to reach out to us again over that email. But I would say that caregiver burden is real and is really important to recognize. Yeah, Jack, I'm sure you have a lot to add there.
You said pretty much all of it perfectly. The only thing I can add is to second that from the patient's perspective. I've said this to a lot of people. I think my mom and dad probably went through it worse than I did. I had goals and I knew myself. I knew at the underlying level, I just knew I had this feeling that I would recover. And 3 years later, I wouldn't say I'm fully recovered. So that's still an ongoing process. But for me, I could work towards something day in and day out. And I was there making it happen where for them it's out of their control. As a caregiver, that's a very tough spot to be in. I know for me, if I was on the other side of it, having that lack of control over what happens would be even tougher on me mentally. So that the caregiver burden is definitely real and something that is very is something that there needs to be awareness towards and has to be dealt with accordingly. On the other side of that, I'm only here because of my support system. I've only made the recovery that I have because of the people that have been in my corner. And that's number one, my parents overall. They made so much happen. They found so many activities for me to do and ways to just continue my therapy, whether it was through set therapies or finding other modalities outside of the hospital, and then supporting me in so many different ways. Family, friends, everyone that was really in my circle was so beyond supportive that it allowed my recovery to be what it was. So those are just both things Dr. Lynn mentioned and said very well is that caregivers are beyond important and there really is a burden that comes with it. So both of those things are very true and need to be recognized.
Thank you. And are there any online resources that either of you would recommend for both patients affected by stroke or caregivers as well?
That's a really good question. Jack did an internship in my lab and has developed it. So there are a lot of different resources out there. The 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 hard thing is that they're a little bit difficult to navigate, and so we've tried over the years in our lab in our program to sort of collate available resources, and it's a work in progress, but we definitely have resources available. So I would say again, if folks are looking for resources or have questions, I would just send an email to us and we can help to triage.
All right, wonderful. So before we end today's session, do you have any final thoughts you'd like to share with the audience?
Just wanted to thank everybody for coming to our session and for helping to raise awareness about stroke recovery. As you can see, it's people recover after stroke, and I think it's really important to raise awareness about it.
I completely second that. I want to thank everyone who gave me the opportunity to be here, whether it was through my recovery or even just inviting me on this talk, this presentation. It's an honor to be part of it, and I attribute my recovery to so many different people, but it really is a progressing field, and the amount of continuing recovery that patients can have is important to look at.
Thank you. Thank you, Dr. Lin, and special thanks to Jack for joining us today and sharing your story. I'm also going to include the Blum Center website. As I had mentioned, today's program is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. I would give it about a couple of weeks, but it'll be made available through there. All right, everyone. Thank you so much for joining us today.
Take care.
Take care.
Thanks so much.
Thank you.